What I've tried to do for the people of Mississippi is tell them what I want to do, how we need to make transformational changes in areas like education and workforce and healthcare, economic development, public safety. We've got a wonderful environment, whether it's being one of the lowest states in the nation for a taxing environment. And I've cut taxes 41 times with the help of the Mississippi legislature since I've been governor. We've got an environment where companies not only want to come here to the state of Mississippi and expand, but the existing industry that we have, we must allow them to grow. In 2013, we decided that we were going to have transformational change in education, just not whittling around the edges, but to do something that would last for generations. We decided that we were going to give schools grades, and then what we call the literacy program, or the third grade gate. It's fairly simple. It basically says you won't be promoted, socially promoted, to the fourth grade if you can't read on the fourth grade level. So we're working on every level. I think in the future you'll see us put even more funding into education. A part of that will be a $100 million pay raise for teachers. When I came in as governor, I was determined to do a couple of things. One, help fill the rainy day fund. Now, you see, that's our savings account, and I was there in 2008 and 2009, where if we had not had that rainy day fund, we would have had dramatic cuts in services like public safety and education and healthcare. Now, one of the things that you also have to do is look at returning some of that to the taxpayer, so you can slow the growth of government and give a dividend, if you will, or a salary increase to the working men and women of the state of Mississippi. So we'll be proposing tax cuts into the future for working men and women. When I came into office, we talked about healthcare as an economic driver. And that means putting more people to work in the healthcare industry. One of the first things we have to do is build a new medical school. We broke ground on that just a few years ago, and very soon we'll be cutting the ribbon on a brand new medical school at the University Medical Center. Our new medical school will help us grow those new doctors so that we can provide health care and have access to health care here in Mississippi. With the help of the Department of Health and educators and churches and ministers all across the state of Mississippi and the hard work of the First Lady, we've reached our goal of reducing teen pregnancy in Mississippi by 15%. If we can stop teen pregnancy, if we can reduce dependency on alcohol and drugs, if we can stop children from dropping out of school, if they will wait to make adult decisions until they're adults, we can fundamentally change the state of Mississippi. Those are the challenges that I took on when I first ran for governor. Those are the challenges that we're finding solutions for every day. We've got challenges and we're not there yet, but working together, we can do dramatic things in Mississippi. We can have great accomplishments. Area Development Magazine says Mississippi is in the top 10 for economic development states. We're number 6 for the lowest cost of living. We're number 5 in America for the growth of women-owned businesses. We're number 4 for the most tax-friendly state in America. Number 2 in America to invest in oil and gas according to the Fraser Institute. This is the best state in America for a doctor to practice medicine, number 1. So when you hear all of those people putting Mississippi down, when you hear that narrative that we're just not good enough, we're not smart enough, don't you believe it. Mississippians are great people that have done remarkable things, and you hadn't seen nothing yet.